Aria mari na wathe wa kuigwa maugite ati uhoro wa ugima mwega wa mwiri na uciari nduri wahatukira wega hari kurugamirira ugima wao wa mwiri makiria mucemanio-ini na uria urari mukawa-ini umwe kaunti-ini ya Embu maugite ati andu angi aria matakoragwo na uhoti wa kuigwa matikoretwo magikorwo makiamukira urigitani niguo gukorwo makirigitwo mirimu itiganite mwandiki rimwe gugakorwo ginyagia matire na umenyo wa ruthiomi rwa kwaria na cieko na uruti wira wa urigitari ningi ni moritie andu a mohoro methe njira ya kuheana ndumiriri cia uiguano riria ingiteithiriria itaigwa gutaukwo.
Mucemanio-ini uria urari Embu, andu aria mataiguaga ni maraugire ati kwaga kuheo uhoro wigi ugima mwega wa mwiri na uhoro wa uciari ni gutumite kugie na muhinga wa kwaraniria gatagati-ini kao na andu aria marutaga wira wa urigitani. Murugamiriri wa kiama kia aria mataiguaga kia Deaf Empowerment Society of Kenya, Jacob Mugambi, ni aroririe thirikari na andiki a mohoro meherie mihinga ya kwaraniria niguo kuhota kuheana urigitani kuri andu aria mataiguaga na makiria andu ethi. Akiari hindi ya githomo gia kumenyithia arumiriri ao maundu ma ngomanio na urigitani tauni-ini ya Embu, Mugambi araugire ati hatari mutauri arugamiriri a maundu ma urigitani matingihota kumenyithia arwaru aria mataiguaga uhoro wa maundu matiganite.
We are requesting you also to advocate for the rights of the deaf people, because the government is focusing with simple languages for the hearing and the blind, but spoken language, but they don't involve the deaf people. We avoid the deaf people, so we want deaf people to be equal, to get equal services of sex, reproductive health.
Augete aciari matire na indo cia kumatongoria kana matimenyaga uria mangiheana uhoro wigi ugima mwega wa mwiri kuri ciana ciao iria itari na uhoti wa kuigwa na undu ucio ugatuma ikorwo itari na uhoti wa kugia na uhoro ucio wa bata na urigitani.
When we are talking about sex and reproductive health, the deaf people should be fully involved and be aware of what is needed. So when parents of the deaf know more about this information about sex and reproductive health, the deaf people will be aware about that.
Jemima Apis, uria urari umwe wa aria marari mucemanio-ini ucio, araugire ati arigitani aingi matire na maundu ma mubango na utauku wa maundu ma mwanya megie ugima wa mwiri na uhoro wa uciari, undu uria utumaga ukorwo uri muritu hari o kugia na utangikirwo thibitari.
The big problem is communication, whereby the nurse will look at us and they will be worried because they don't know how to communicate to us. So they don't value having the best way of communicating to us. So they will talk to us, but we can't answer or say anything on what they are talking to us. So we have a lot of barriers. That is why we are not involved mostly in the reproductive issues.
Wini, umwe wa andu aria matari na uhoti wa kuigwa, araugire ati angikorwo aria marutaga wira wa urigitani ni moi kwaraniria nao, undu ucio no umateithie kuheo uteithio uria wagiriire.
When you are going to the hospital, we have to have interpreters, maybe the nurses, they should know how to communicate with us. This one will help us to ease communication in the health facilities, and also will have equal access to information.
Ningene marahoire athondeki a mohoro na programu mathondeke ndumiriri na programu cia ugima wa mwiri na uciari niguo mahote kuhingia bata wa umenyo na ningi makiona ati handu haria
so the interpreter is very tiny at the insertion.
Frida Murage, GTN TV.